Yes, ma'am, I'm ready.
All right. So if you've read and understood, considering it critical care scenario, please tell me what is happening with the patient and how would you go about managing it?
This could be a high epidural block
Very
and
good. Okay.
distributic shock from
All right.
high epidural block, paralysis of
And
the intercostal muscle,
okay.
paralysis of diaphragm, and postoperative hypovolemia.
All right. How would you go about and how would you manage it now? What are the
I'll manage
steps
this
that you'll
case.
follow? Yes.
I'll manage this case according to the care of critically ill surgical patient with
Very good.
ABCD approach. I
Yes.
will assess airway by
Yes.
look, feel, and listening. If patient is speaking, then the airway is pattern, and I will assess breathing by counting respiratory rate, oxygen saturation, and bilateral chest movement, and by percussion, I will see the centrality of the trachea, and auscultation, I will see if there is any added sound, and circulation, I will insert two whiteboard cannula, one for resuscitation and one for sending blood sample, like full blood count, urea, electrolyte, and ABC, and um,
In
and
your
then
management, what are the things that you
management.
have missed?
And ma'am, I will call the operating consultant and
Did you give oxygen?
anesthesia
How much
consult.
oxygen have you given?
Yes, ma'am. I will give 100% oxygen and
Okay.
sit the patient upright, and I will stop any medicine in the epidural catheter, and
Okay. Did you say you'll
uh,
stop?
and
Yes. This was the
yes,
first
ma'am.
step that you had to take. First, the moment you realized what's happening, the first step was after you said you'll manage it according to the critically ill ABCD protocol. First thing was that you'll stop epidural immediately and then you'll arrange oxygen and then everything else. All right, please tell me why this patient is bradycardic.
Uh, the epidural block due to blocking of the cardioaxillary fibers
Yes,
from T1 to T5,
yes,
and unopposed parasympathetic action from vagus nerve.
very good. So please tell me what are the causes that might have caused this? Why epidural might have caused this situation? Because normally when we give epidural it is for the betterment of the patient, but if patient presents like this, like in this scenario, that means what? Please give me at least three reasons.
Uh,
You said one, that
it's
maybe it was at
and high
higher level.
epidural block,
Yes. What can be other two reasons?
doses of the drug,
Yes,
and
incorrect dosing.
posture,
Yes, incorrect
and
positioning.
posture,
Yes, very good.
and age, height, and weight, and type of the
Dose, there is
medication.
increased dose, like when you have calculated, when one has calculated the dose wrongly. Okay, what are the differential conditions or differential diagnosis you would consider? One, you've already said high epidural block. What are the other?
Distributic shock
Shock.
due to
Okay.
epidural,
Yes. Two.
and paralysis of the intercostal muscle,
Right. Three.
paralysis of diaphragm,
Four.
and postoperative hypovolemia, and
Okay. Yes.
hemothorax or pneumothorax.
Or neurothorax. Okay. Pneumothorax. Okay. How should one normally test the level of the block? What is the
By
protocol?
temperature sensation,
Very good. Ice pack. Okay.
ice pack.
Right. How would you differentiate if this high epidural block is because of hypervolumic shock?
Um, in hypovolemic shock, there will be cold periphery and tachycardia, and in epidural block, there is warm periphery and bradycardia.
All right. Good. Okay. Cold and clammy peripheries and tachycardia. Okay. All right. Why do you think test for the temperature sensation is done rather than testing for the pain?
Pinprick sensation, there is risk of bleeding and possible infection, and it
No.
is painful.
No. Which fibers convey or conduct
Yes,
temperature? They are the faster fibers.
pain and temperature sensation are
No, not just
sensation
pain.
fibers are similarly affected.
No.
And
We'll discuss pain later. Okay. Please tell me what are the systemic effects of epidural analgesia?
uh, systemic effects. Um,
You can read here hypotensive, hypotension.
Hypertension
Other?
and attenuation of neurohormone stress response, and
No. One is systemic. Okay. Talking about the whole system. One is hypotension. What this hypotension causes? It leads to reduced cardiac output. This
yes,
reduced
reduced
cardiac
cardiac
output
output,
causes what? That causes
reduced
reduced
cardiac
venous return. Then what happens?
reduced.
This you need to revise. Okay, please tell me what are the advantages of giving epidural over any other anesthesia like general anesthesia or spinal?
Early mobilization, pain relief for a longer period, and improved cough reflex and decreased neurohormonal stress response.
Anything else? Okay, can you give me
And
some
better
examples
outcome.
of, we'll come back to this later. Okay, can you give me some examples of surgeries at which different levels of epidural can be given or is normally given?
Um,
Like if you want to operate on upper abdomen, you'll give epidural at the level of T4.
T4 and stuff.
And
And vaginal delivery at the level of
T10.
T10,
Yes.
and
All right, there are certain other examples as well, but you cannot.
sacral 2
All right.
and rectal surgery.
Please tell me if you suspect that patient has overdose or epidural toxicity or overdose, what should one do immediately?
Epidural overdose immediately. Should give uh, phenylephrine or uh, norepinephrine, and inotropic agent, and chronotropic agent like atropine.
Immediately, you'll call
Uh,
the crash trolley. You'll call the consultant,
Doctor,
and you'll stop
consultant, and anesthesia.
the
Yes,
epidural.